There's a growing movement among patient advocates to get Americans to take control of their medical records. After all, if marketers and bill collectors can access medical data, consumers should be able to easily access their own records too, and there's no shortage of technology to help. So here are 5 tips for taking charge of your medical data. Number 1, get your data. Federal law gives people the right to obtain copies of their records from doctors' offices, hospitals, pharmacies, walk-in clinics, and labs, virtually any place you receive healthcare services. While some big hospital systems like Kaiser Permanente and the Cleveland Clinic make it easy by setting up patient portals, this can be trickier in smaller systems and physicians' offices. Regardless, providers must act on a request within 30 days or ask for an extension. They can charge for the cost of reproducing the records, but not for searching or retrieving them. And if you ask to receive the records electronically, providers must generally comply. Having your records will empower you when you want to consult a specialist, seek a second opinion, or shop for less expensive care. Number 2, organize it. A number of software programs and apps can help once consumers have access to their data. Prime, a California-based company, says its app pulls and stores users' medical records and functions with over 2,000 healthcare providers. iBlueButton can display health records from Medicare, Veterans Affairs, and receive care summaries from many doctors and hospitals. The app can show every doctor, hospital, and ER visit a patient has had, plus any lab test, X-ray, diagnosis, and any prescription ordered, including when and where it was filled. Number 3, share your health data with family members and doctors. A slew of apps and programs are being designed to also help people share their medical data with family members and healthcare professionals. Microsoft Health Vault, for example, can combine data from a wide variety of medical devices, consumer apps, and electronic health records. It also lets users generate letters to their providers, giving them instructions about where and how to send records securely. Number 4, generate your own health data. There's a growing constellation of wearable and wireless devices that help consumers generate their own health data. From fitness trackers that count your steps and calories burned, to more advanced tools that monitor things like blood sugar and help patients manage chronic diseases. For example, Twine is an app that helps people with hypertension manage their disease day to day. Patients use it in conjunction with healthcare providers that also have the program to monitor their condition. Using devices such as wireless blood pressure cuffs, patients can transmit blood pressure readings to the app and share the data with their doctors. Many wearable devices and apps don't necessarily transmit data that can be integrated into a patient's records in a useful way. Check with your healthcare provider to find out if your doctor is interested in receiving data that you track on your own. Number 5, protect your health data. There are some privacy and security downsides to having medical data available at the swipe of a mobile device. Password protection is critical so that the wrong people can't access personal information. And privacy experts caution that once medical records are downloaded into an app, the data are no longer protected by the Federal Health Insurance Portability and Accountability Act, known as HIPAA. Most fitness trackers aren't covered by HIPAA either, which means the data they collect can be disclosed, even sold, by the developer. Many apps are free because they sell your data, so be sure to check out the privacy policies for any apps you choose.